Measuring the effectiveness of a novel brace, the Armlock, in the treatment of chronic tennis elbow. Lead investigators were Adriana Rincon and Antonio Cruz. This is what was researched, the Armlock brace. This research was funded by myself and through the support of the federal program called MITAX. For a medical product to gain acceptance by the medical community, research and validation are essential. For the study, patients wore the brace 30 minutes a day. The brace provided a gentle stretch to all the muscles on the back of the forearm. These are the muscles that contribute to tennis elbow. The amount of stress applied to the tendon muscle complex was gentle and was nowhere near the failure point of the tendon. The tension was always within the patient's control. Stretching slowly pulls out the crimp, which is the waviness of the collagen fibers within the tendon. When a patient first applies tension, they may say, "Ooh, Nelly, that's a bit of pull." But as the crimp is taken out of the tendon and as the actin-myosin bonds within the muscles release, the tension reduces, and within a few minutes, the Armlock brace is relatively comfortable. In private practice, this is the stretch that I did, and I held it for a long time, and it really worked on my patients treating tennis elbow. For a patient to be eligible for the study, they had to have tight forearm muscles, which most people with tennis elbow have. The results of the study. By 6 weeks, pain and disability was both down by about 50%. With another 6 weeks, pain and disability continued to go down. So how did I come up with the Armlock? Well, it was by accident. My wife had plantar fasciitis and I got her this sock. And this sock stretches out your calf and the plantar fascia, which really works on treating plantar fasciitis. So I was goofing around because I'm a bit of a goofy goober, and I put it on my arm, and that was my eureka moment. This is how I stretch my patients, right? So I converted the sock to a glove and a sleeve, and I added a stabilizing bar, and voila, the Armlock brace was created. Tennis elbow is that pain on the outside of the elbow. It is most often attributed to repetitive activities. The muscles on the outside of the forearm refer pain to the elbow. And I repeat this because it's very important. The muscles refer pain to the elbow. There can be nothing wrong with the elbow, but the affected muscles will make you feel it at the elbow. It's like when you have a heart attack, which I don't hope you have, but if you were to, you may not feel your heart, but you feel your shoulder pain or scapular pain, and that's referred pain. Trigger points are created when our muscles are contracted in the shortened position. So trigger points refer pain to the outside of the elbow, and these trigger points are little knots or little cramps within the muscle. How do we create cramps? For example, you're laying in bed and you point your toes down, you're contracting your calf at inner range as strong as you can. You'll get a really wicked cramp. How do you treat it? You stretch it out. Clerical people have high prevalence of tennis elbow. Look at her wrist and her fingers. They're both extended, muscles contracting at inner range, and we do this for months and years. So the muscles get very tight and they do create these trigger points. You can see on this little video clip how this position stretches out those trigger points. And this is what the Armlock does. In this video, we see how your finger extensors go to the lateral epicondyle, the outside elbow bone. So to treat tennis elbow, you have to treat your finger extensors. And also consider when you grip, it's not just your wrist flexors that squeeze, your wrist extensors also contract to stabilize your wrist. Note, if tennis elbow is more attributed to a muscle tear, a tendon tear at the elbow, after 6 weeks of rest, tension is very important to stimulate the tendon cells, the tenocytes, to produce collagen to make that tendon stronger, especially the tendon stronger in lines of force. Just as bones need compression to get bones stronger after a fracture, 6 weeks after a fracture, tendons need tension to get stronger as well. So for more information, look up armlock.ca. That's my website. Thank you.